Good morning, everybody. I'm James Ashley, dentist at Woodlands Dental Practice, and this update is regarding the latest changes in our service. We are continuing to struggle with the restrictions on dentistry and the new way we have to work. The biggest problem we have is when we do certain treatments that create a spray, and that spray then means the room after that treatment can't be used for, in most cases, another hour, and then it takes about half an hour to clean that room down before we can treat another patient in it. This is our main challenge at the moment, and because those treatments are taking up so much surgery time, we have to restrict how often we do them, and for that reason we now have quite a considerable waiting list for routine fillings, crowns, bridge work, root treatments, and also that spray type treatment is sometimes used in a scale and polish where there's an ultrasonic instrument used which creates a spray. So all those treatments are heavily restricted, and we're doing our best to prioritise who should be seen first, and of course that's people in pain are the biggest priority, but then people where we think the problem they have, if it be deep decay or root treatment needed, we'll prioritise them if we think that's going to change or become worse in a short period of time. Things that we might have to put as a low priority could be a tooth that's had a corner break off, that's been repaired when you've come in, and might need a further long-term filling or crown, but for now is stable. So day by day and week by week, we're trying our best to make decisions to keep people getting access to treatment that is of high priority. One of the things we're doing to try and increase how many patients we can get through in a day is to make as much of the admin that we have been doing in the surgery be available for patients to complete online before they attend the practice. So the classic thing of medical questions which we have to ask to check you're healthy enough for treatment can all be completed online, and you can fill in which medications you're taking, if you have any allergies, or if your health is unstable in any way. Please take your time over that, and then the dentist will check it when you come in. Also, for patients who are receiving NHS treatment, you can sign your forms to show whether you are exempt from charges and enter the right details, or sign your form to show that you do pay for NHS treatment, and payments can be taken over the phone before you arrive. This way, when you come in, we can be focused on the dental problem and treat you promptly, and then hopefully keep you in the premises for as short a time as reasonable. We are worried this is almost a little bit rude or rushed, but the days of being able to catch up and have a good chat and spend time talking, I'm afraid at the moment the pressure we're under and the safety in being in the practice for a short period to reduce any risk of COVID transmission is really important. So we're going to try and keep as much of the admin completed before you attend, and then we can just get the teeth or the dental problem assessed and treated, or booked in for the right treatment, or put on a waiting list if that's not immediately available. There'll be some more videos on which services we have running, and if you would want to look on the site and click on the links, there's more information there. Any feedback is greatly received, and we are doing our best under these restrictions to provide a really good service. Thank you for your patience, and thank you for listening.